Hello.
Hello, Wojciech.
Hi,
How are you?
Thomas. Thanks, good. And you?
Very good, very good. Busy, quite good, busy. Interesting things.
Definitely, definitely.
Have you been watching a bit of the presentations?
No, no, I didn't manage. I had a meetings today for
Yeah.
noon, so I'm right on time,
Okay.
straight from other duties.
Okay, great. So look, we got other guys popping in. So we've got three juries on this panel.
Great.
Myself, Christian Mikowai. This is Christian. Hello,
Hi,
Christian.
Hi.
how are you?
Good.
Hello,
And
Mikowai.
you?
Fantastic.
Good. So we're all on three juries on this particular panel, and I'd like for each of you to do a 1 minute introduction. Let's start off with Mikowai, please.
Hi, good afternoon. My name is Mikołaj Gurdawa. I'm an InnoStars Innovation Manager. So we are the partner of, let's say, this today's Wolf Summit edition. Let's say on daily basis, I work with the startups, with academia, and also industry in a healthcare, let's say, domain. I'm based in Łódź in Poland, although I work with the companies in Central and Eastern Europe, but also in Portugal and Italy.
Nice.
And
Nice.
yeah, and we also found, let's say, a voucher to our mentoring coaching network in the evening. So yeah.
Yeah, that's you're giving away 2,000 euros. I understand of value for coaching for whoever you choose from the medical companies today, right?
Yep. So there is also my colleague Tamas Bekashi from Hungary, our Hungarian office. He was in the previous session with the medical startups. So we are going to consolidate the results and announce them in the late afternoon or early evening.
Okay, great, cool. Okay, Christian.
Hi, I'm Christian Kumar. Now, my firm is Capital Kinetics, but we run a MedTech investment fund in Wales. So we try to import medical diagnostics and devices into the UK.
Great.
Okay, short and sweet. Wojciech.
Hi, my name is Wojciech Majewski. I'm partner in Simpact Fund, the early stage of development companies focused fund. So we are kind of a sector agnostic, but we try to target companies that are social impact aware. So we try to be the first impact investing fund in Poland.
Okay, great. So we're going to stay on schedule. Thank you guys for all being on this jury. And we will start with our first presentation pitch is from FertereX, Maris Belta. Maris, are you there? I think you are. Yes, cool. I got a thumbs up. That means he's there. Maris, joining us in 1 second. Good. Hello, Maris.
Hello. Hello.
Welcome.
So I have to share my
Do you have a screen share?
yeah.
Great. So do that. And once that's done, I will push the button and say go. And when you're ready, assuming you're on Google Chrome, which is the right browser.
So can you see it?
Yeah.
We are about to. Yes, on. So 3 minutes, go.
So hi, I'm Maris, CEO and founder of FertereX. We are for healthy sperm and male reproductive health at all. You know this. What is it? It's sperm. It's male sperm, most critical component in creation new generation of life. But did you know 1 in 5 men has low sperm quality, and it becomes worse with age. Up to 100 million infertile couples struggling to have a baby, and half of the problem is men. Global infertility market reached 20 billion euro. It's basically due to in vitro fertilization. If to look in Google Trends, we can see that people are looking for male infertility double as for women.
I think Maris is frozen.
Yeah.
Infertility. So why next slide doesn't work? But okay, let's go to this one. This is our solution for it is FertereX. It's our first photobiomodulation therapy. Which solution is patented. We got Latvian patent and it's submitted for European patent as well. Man just has to sit on it twice a week for 10 minutes and get this photo biomodulation sessions. We did our pilots with local Riga University, and we got quite good results in sperm motility in 2 months, plus 11% in morphology, and also in sperm count. A part of it, it also raised up testosterone level as well. So it ongoing effects of it. So I'm too fast. We have good testimonials from our doctors, and they are keen to try. And right now we finished our first experimental batch to give to our clinics. For 50 items we produced. This is what we did. And if to speak, I'm not happy about it. Man each says with in normal way, it's in vitro insemination costs average 20,000 per couple euro, and our device is considered to be less than 1,000 euro. So we believe some couples can save money with it. Next one is our rising, and I believe my time is over. I'm doctor and partner is also doctor, and it's me with my 1 year kid. Me is 50 years, my kid is 1 year. So you see FertereX works. It's not just joke. We have a part of our pilot study. We also have one success case. We have
Maris.
read the links, not just our. So I'm finishing. Thank you. I'm ready for
Okay,
questions.
great. So good Q&A. 4 minutes. Who wants to start?
Can I ask a question?
Go ahead.
Okay, thanks. Can I ask a question about your business model? And could you say a few words more about your sales strategy? Because you want to sell the device, yeah? How you going to approach your customers and how you're going to sell it?
Yeah, we believe we are going to work with clinics, and rather with first-time clinics, regular gynecologists and fertilization. So rather as negotiated with local doctors, they are accepting very well, and regular gynecologists, they are ready to prescribe this device, and there could be two directions. One way that we can rent this device for the time. I believe you see we have those disposable transparent covers, so we can have extra long run incomes to sell those covers, and the device could be rented. This is one. The other ways it could be sold. This is basically so working through association of specialists gynecology to approach.
Okay, thank you.
Christian?
Maris, I know we met back in October, and my question really,
I remember.
how many people participated in your clinical study?
Very miserable. 10 healthy volunteers in this sperm study. Out of those 10 healthy volunteers, just half had normal sperm. This is, but despite those are young students. And a part of this pilot with Tradition University, we did also with 16. We have 16 cases of testosterone study. Average testosterone increase was plus 60% in one day, or next morning already after one session. So we had 16 participants for testosterone and 10 for sperm study.
I mean, it's more than fertility. It's also a testosterone improvement, which affects elderly men. Yeah. Thank you.
Yeah, this is our plan B, that we can go also for as consumer product for testosterone boosting. This is and then it could be cheaper, could maybe for everyone, because testosterone level, it's not just sexual health, it's also general health. It's a prophylaxis of osteoporosis and for even Alzheimer's disease and so on, and for cardiovascular risk. And so could be also this plan B. But we're gonna focus, because I'm medical doctor, my colleague, he's gynecologist. We want more go for this medical device direction to cope with male infertility.
Okay, thank you.
Mikołaj?
Maris, one more question. Yeah, one more question from my side. So what is your current, let's say, regulatory pathway? So when and how you want to register your device, in which class? What is a plan for this?
But we have contacts with guys who are doing, but and of course there should be prepared all files for notified bodies to go on. As far we created our prototype, we did it in correspondence with all requirements for medical device. But of course, this is all we have to go on. Today we have just certificate for electromagnetic compatibility that allows to sell it, but of course it's long way to have this certificate of MDD, medical device clearance, CE mark. Yeah.
I was going to say it's a joke, but maybe it's not a joke. Get someone like Keenarps to put this in all of their office furniture for males.
Good idea.
Okay, Maris, thanks very much. Great presentation. On to the next one, which is RAMPmedical. And instead of Alejandra Abel, we'll have Helena today, who will be presenting. Helena, I think you're there.
Hello.
Yes.
Hi.
So I'll set the clock for 3 minutes. You have a screen to share?
Yes.
So do so now, please.
How does that work? Anwendungsbildschirm. Home tab. I would know how, though. I can just talk like that, but I don't know. I don't find a button.
No problem. That's more important.
There's something. Well, I think I just have to say it like that. Actually,
I think it's great. No problem. We're going to listen to you anyway. So go over to you.
Okay, great. So hello, I'm Helena. I'm the CEO and one of the founders of RAMPmedical. We provide a tool for doctors. It's a software that helps them make the right treatment decision. Wrong treatment is really a common problem. According to the World Health Organization, 1 in 10 patients does not receive the right treatment. And it's not that we don't have amazing doctors, quite the contrary. The challenge is that there is so much research coming out every single year. It's simply impossible for any doctor to stay up to date with all of this. And we tested this with diabetes specialists and found that in 29% of the cases, the doctors chose a therapy that the European Medical Agency labels as dangerous, meaning that this could potentially kill the patient. And we tested where doctors used RAMP, our software, as support, and here they found the optimal treatment almost every time. So Jacques, Eret, and I, French, I'm German, we founded the company because we saw how difficult it is for doctors to make the right treatment decision. And we had a very great person, Alejandra Aber, joining us later. She had already founded another company, and we were really lucky that she joined our project. And we could by now engage the leading hospitals in Switzerland, in Germany, Charité and University Hospital Lausanne. And since recently, Siemens is supporting us with sales and integration. So we have some of the head doctors of university hospitals in Switzerland and Germany on our medical advisory board. And our business model is very simple, is we sell to doctors individually through doctors' trade associations, like medical associations, and in a longer sales cycle to hospitals in a revenue sharing sales cooperation with practice and hospital software providers. So we founded the company 5 years ago, building up a unique IP, testing the concept and the technology. We received the medical device certification. We received 3 awards recently, the Corona Impact Award, I call it like that, from EIT. And we intend to break even by the beginning of 2022. So we go with 3 products into an over 2 billion euro market in Europe, MENA area, South Africa, Canada, and India. And well, our product is available as app and desktop version. It's very easy to use. I'm over, no? Time is over? Was it the bell?
Wrap up if you got a few more
Okay,
things.
good. I want to say it's easy to use. We need the patient data in the system. And in the second step, the doctor chooses one of the recommended treatments. Yeah, that's it. Thank you very much for the attention.
Okay, cool. So I'll go straight to questions. Who wants to start?
I'll start very quickly. I mean, I know the healthcare system in the UK have a sort of a national institute that recommends treatments for doctors to follow. It's the National Institute of Clinical Excellence. So would your advice not be contrary to healthcare advice from within each of the countries?
No, actually, we include these local guidelines. It's one of our sources. So we include the guidelines, the local guidelines, but mostly even the doctors, even in Germany, and the doctors who in our medical advice board, they are co-authors of the German guideline, but they like a lot also using the American and European guideline that we provide to. And then we base on publications and on the official certification material, summary of product characteristics.
Okay, just one very quick question. Liability. So if a doctor is reliant on your information, does that transfer the liability onto your shoulders for providing a recommendation?
No, that wouldn't even be possible. What we say to doctors is, or our disclaimer is, that they have to be reminded of what they already know. When they learn new things, then we always provide in one click the link to the source where they can read it in the official source.
Understood. Thank you.
Can I ask a question about the competition, how it looks currently, and what makes you different and better than alternative solutions and companies?
So according to our research, our product stands out the grade of support for doctors, the accuracy of information, and the technical uniqueness. And we are really the only ones being able to scale easily throughout multiple medical indications.
Okay, thanks.
Alexandra, nice.
Nikolai?
Oh, sorry, I was muted. So, Alexandra, thanks for sharing. Yes, great presentation. Nice to see EIT Health startup in this competition. So, my question is about the scalability and actually who is going to pay for your solution. I can see you're trying to target different countries, let's say the variety of different healthcare systems, but how you want to tackle a very fragmented healthcare systems and different payers, different strategies to pay this type of procedure.
So even you're right, in Germany already between the different medical specialties, there's already a different system. So we found a pattern that is that we reach individual doctors through their trade associations. Sometimes it's medical associations, sometimes it's side associations where they purchase things. And then we sell through to hospitals and sales corporations with the medical record software providers. And this is in all countries now, even in emerging markets. We had market tests there, and it seems to be the right way everywhere.
So I mean, so how fast you assume that, let's say, you will be able to grow actually to kind of touch the break point even for the company? I understand you have to teach the algorithm, feed it with data. I mean, hire salespeople. So let's say, how
Yeah.
big you have to be to, let's say, to be in this safe point?
So by the end of the year, we intend to close a funding round of 2 million euros. And in the year afterwards, we want to reach already a 1 million revenue. So it's once it's integrated into a software, we can scale all rates through the software. You know, like let's say Cerner has, I don't know, 1,000 clients. We can provide it to all their clients.
All right, guys, I'm going to cut you off there. We're on a tight schedule. Helena, thank you very much. Appreciate it very much, and good presentation. Okay, we are on to YuMuuv. Jakob Remmel from YuMuuv. Nice name. Jakob, are you there? I think you are. Apparently, Rafael says he is, so that means he is. Good. Jakob. Oh, he was there.
Yeah,
left already.
Right there.
Yep. Hey, Jakob, do you have a screen to share?
Absolutely.
Okay, if so, do so.
Let me. Hopefully, you can see it. No.
Not yet.
Oh, yeah.
Are you in Google Chrome?
Yes, I'm in Google Chrome.
Okay.
For some reason, it doesn't work, but.
I'm gonna try one more time, and if not, just go without it.
Yeah, let me just
Improvise, Jakob. That's half the job of an entrepreneur.
that's
right?
that's the way it is, but that's
You're on 3 minutes.
okay. So my name is Jacob, and I'm the CEO and co-founder of a company called YuMuuv, and let me still try to
So
do
trying.
it. Yeah. So
Okay,
hopefully,
yeah.
yeah. Okay. So basically, we're right now living in a world where we have different problems, and one of those problems is that there's a decreased physical activity trend that is especially happening in the Western world. And so one way we have those different devices that measure our activity, we have more knowledge about our health, but at the same time, it doesn't necessarily calculate over to people being physically active. And so one of the reasons behind is that companies and corporate world hasn't been able to actually measure the physical activity of their employees. They cannot actually encourage people to do that. It's rather being athletic ability rather than physical activity. So that's the reason why YuMuuv was created, really. And so what we do is that we gather activity data from different wearable devices. So Apple Health, Garmin, Fitbit, and others. We analyze that, make it comparable through our activity formula. So that would calculate in person's personal profile. And so everybody can see their own progress. They can see how their colleagues are doing, and they also can see how their company ranks to other companies. So far, our business model is pretty simple. We offer this SaaS platform, and we also rent out wearable devices if any of the company needs it. Our strategic partners today are Microsoft, as we are in their startup program, and also Garmin, enabling us those devices, rent and resale and tests. So far, our financial world looks like that. So basically, we started really finding product market fit in the beginning of this year, and during the Corona crisis, we were able to grow because different people switched off other options and they switched to digital health. And I would say that, for example, our clients today are concluding Estonia's largest bank, largest telecom company, largest retail store, and transportation companies. So what we see is that that's a very easily scalable product, and both in the wise of the legal part and also the technological part. So what we want to do in the next 18 months is basically we want to reach globally with our product. This means that we have to automate our sales and start with marketing. We haven't really done that yet, and really launched our product beta version based on the on the feedback that we have gathered so far. So that's the idea behind, and basically I would just tell our unique value proposition is that we measure the activity, not the physical capability, and this puts everybody in the equal perspective where they are, so they can actually feel the success of being physically active. They can do whatever they like, not just one particular activity. And also having this company leaderboard, we believe that this is basically like a NASDAQ for physical activity for companies in the future. So trying to get that market on our hand would be the very good impact for the larger future. So thank you, and hopefully this was helpful.
Cool. Questions, Q&A. Who wants to start?
Jakob, how are you pricing this to the company?
So basically, we're pricing it right now based on the number of employees. We are starting from 39 euros if they have 20 or less employees, and it goes up to whatever number the company is. It will be basically the range between 40 cents up to 2 euros per month. I think one of the struggles that we are currently facing is that companies are using it not like ongoingly. So for example, somebody uses it a couple months, then pauses it, then comes back. So this is what we are trying to do, is we're trying to advance the things that company actually gets from the platform. So yeah, that's the logic behind. But basically, we are charging for monthly basis.
Okay.
Wojciech?
Jakob, do you see
yeah.
any field to cooperate with insurance companies, for instance?
I think that's definitely one way, because that's where the industry is going, and especially like everything related to activity monitors. We still haven't done it in our world yet, but there's a possibility, of course. Yeah.
Okay, thanks.
So 2 questions. So the first one is regarding, let's say, your relationship with all these, big let's say, devices or IT companies. So let's say, what is the benefit for you and for them to have this? Let's say, I would like to understand better your relationship with these companies. And the second one is, let's say, well, this is a fantastic way to gamificate the let's say, a certain competition among the employees, but this works only where, let's say, a majority of the colleagues in the company follow this. So what are the other incentives you want to bring to make employees use this let's say, application in the company?
Yeah, so I'll try to answer both of the questions. So first, what we can offer for example, Garmin and other device companies, we can actually contribute their devices to companies. So let's say there's a company, about 25% of the users might have a wearable watch that actually measures heart rate and so on. So we will say that, we talk with companies, they will offer those devices to people who otherwise would not be buying those devices. So basically they are renting and getting the first use experience. This is what's happening with Garmin for us. So we are helping to resell their devices or rent those. And also for us, it really gives an opportunity to offer the best possible experience, and we get certain revenue out of it. So related to people being physically active and getting the maximum percentage of people, I think that's the key element. For us, so far, it has worked that people first have to experience that they will get some success there. So this means that, as I was telling, like the physical activity measuring, why it's so good key. Let's say 2 people. One is very fit. He walks up the stairs. He doesn't get his heart rate up. But there's the other one who is not so active. So he or she will walk up and get some heart rate up. So they will gather some activity points. So this basically creates an equation where your physical shape isn't the one that determines whether you're successful there or not. It's your whether you actually exercise the activity or not. So this makes people who are not so successful in sport do actually very good on our platform.
Cool. All right, we actually the buzzer just rang, so we're out of the Q&A time. Jacob, thanks a lot for your time. Presentation is very interesting. We're going to move along straight on, stay on schedule. Next one is Familify. Familify will join us is Francisco Cornello, and so he's joining us here in a second. Let's see who we got.
Guys.
Familify. Hey, Francisco.
Hi.
Hey.
Do you have a screen to share?
Yes, absolutely.
Okay.
Just give me a second.
Where you live? Where are you from? Where are you?
I'm originally from Ecuador. The company is based in the US, though.
Okay. Great.
Can you see my screen now?
Yeah, we see a screen. So go. You're on. Got it.
Awesome. Thanks. So I'm the co-founder and CEO of Familify. I don't know if there are parents in the room. But most parents will know that kids are awful sleepers, especially in the very first years. And that's a problem Daniela, my wife, and I had. And it led to one of the worst crises in our family. But it's not a problem that happened to only us. 2 out of 3 children don't sleep well. In fact, there are over 800 million children worldwide with sleep problems. And according to UNICEF, sleep is as important as nutrition, yet it's highly overlooked. Sleep is related to health. If your children sleep well, their immune system increases. They have less chance of overweight disorders. And also sleep is related to brain development. What I found interesting about sleeping is that it's correlated to mental and emotional health. So the better emotional health a children has, the better sleep he will have, and the same way around. A good sleep increases melatonin and oxytocin, which are the hormones which relate sleep, and decrease risk of child depression. So it's a very important problem to tackle. Daniela and I tackle this through this solution, which is Storybook. Storybook is an app that helps babies and children to sleep better by combining natural therapies like infant massage, bedtime stories, and music. There are thousands of studies about how each of these tools work individually. We put them together into one app. I will share a quick video of how Storybook works. I will be, showing it. Hopefully it will play. Great. So I don't know if you can hear the sound, but when you log into the app, you will select problem you want to treat. Our technology will recommend stories based on that, which are in fact audio stories. If you're hearing, there's a voice telling the story now, and the children will only listen, and like this. So parent will be following the guidelines. That's it. It's pretty simple, but the good thing, it works really well. In fact, 80% of parents report that their kids are sleeping better since they started using Storybook. But the good thing is that 89% of parents feel more connected with their kids. And as we see it, the sleeping is a consequence of this moment of bonding. Our business model is a yearly subscription of $60 a year. We are available in Spanish, English, and Portuguese. This is how we see the opportunity. There are 600 million parents with smartphones and kids ages 0 to 6. Just in the Americas, they spend $7 trillion raising their kids every year, which is more than the banking and oil industries together. In order for us to reach 100 million ARR, we only need to tackle our top 7 performing countries, and we need to get 1.4% of that target audience. That will lead to $100 million in yearly sales. And what I really like about this slide is our current CAC, it's less than $12. It cost us $12 to acquire 1 paying subscribers. Quick overview of our achievements. We have been the #1 parenting app in over 60 countries on Google Play. We have over 500,000 downloads, and we have sold close to $400,000 so far. On April, we surpassed our break-even point, and we are growing at a 4% average month over month. We also cater for companies. We have sold 17,000 subscriptions to companies like Kimberly-Clark or Nestlé. And this is our founding team. As I mentioned, we are all our parents. We have a great team of doctors, psychologists, and experts on the area who collaborate with us. And these are our plans coming forward. So we aim to surpass $700,000 in sales this year. By next year, we aim to surpass 1.5 million and 2 million users. By the end of 2025, we aim to have $20 million in year recurring revenue and 11 million users. Right now, we are focusing on the product, but we don't want to stop there. We want also help with the education part of sleeping and bonding. We will launch a community platform and eventually a marketplace. So that's Familify. We're growing at a 40% average month over month. We have over 500,000 downloads and close to $400,000 in revenue. And we're available in 60 countries.
Okay, let's start questions. And I'll start off with what money are you trying to, how much money are you trying to raise?
We're raising 1 million. In fact, we haven't opened a round yet. Our plan is to open and close the round in August. We already have $200,000 committed without even trying. So we are very confident we will have great investors in this round.
Okay, great. Questions?
Could you say a few words about your main? Oh, go on, Mikołaj.
So how, Francisco, so how much your app might work with the Internet of Things, with the other devices and collecting other data than just, you know, symptoms that partners see? So something that is more tangible and, let's say, hard data.
Sure. So as of now, our data or app captures what the parent is inputting. So my kid is sleeping 8 hours, 9 hours, but we definitely see a good opportunity down the road to partner with devices like monitors, sleep monitors, which can provide data so we can work to improve that data. We have a social impact plan, and our aim is to help kids to sleep the right amount of hours. And the best way to do this is by measuring through these kind of devices. So we definitely see that happening in the next couple of years. That's why the marketplace makes so much sense to us. If we already have 10 million users, we can pretty much show them some products that might be a good fit for their current problems.
And could you say who is your main competitor currently, if you have any, of course? Sure. Yes. Moshi is an app with audio stories. This was created by the founders of Calm. Last year they sold over $40 million, and they have raised close to $48 million so far. But the good thing about us is that with Moshi, you just leave your phone beside your kid's cradle, and you walk out of the room and you go, and he will be listening to some stories by himself. In our case, we engage parents in the process, so that helps us to cater younger children from prematures to 3 years old, which they don't really work with them. Half of our user base is on that bracket, but also we foster human connection, which they don't. So we have a great opportunity facing them. Okay, thank you. Thanks.
Next questions?
Not for me.
Cool. I don't know if that means not interest, or you covered everything very well. You certainly.
I hope it's the latter.
No, I think it is. I think you covered things very well. Interesting application. Great. You got so much revenue already so fast, and breaking even already is super. And I guess you'll get that 1 million relatively quickly. Francisco,
Hopefully.
Thanks very much.
Thanks so much, guys. Thank you.
On to our next one, which our last one of this batch, which is MedIT.
Hello, everybody.
Hello. Yeah. Hi, you're right there.
Yes,
quickly.
I'm trying to
Have you got
share my screen. Yeah, it's working.
Okay. Not yet. We don't see it.
No. Why?
We see your guitar in the background. But
okay. I'm clicking it, but nothing happens.
Are you Google Chrome?
Yes.
Okay.
Don't know why.
Okay, you want to go without it?
Yes, of course.
Or Marius, you could refresh your screen. That might also work. Refresh it.
maybe.
Try again.
Sorry. Maybe it's a MacBook settings.
Could be. Okay, you want to go without it?
Yeah. So, hello everyone again. I'm Mariusz Kurman and I'm a co-founder of MedIT Solutions, where we believe that medicine and technology can change life for the better, and that's why we are making medical solutions. And our first solution is MedCases. It's a virtual patient application for medical students and doctors, where they can practice. And we are solving two main problems: acquiring and expanding practical knowledge from anywhere on Earth, and the second one, basically, because the current situation, epidemiological situation, is that students cannot gain their knowledge during hospital classes. Sorry, I will. And our solutions is this is the unique e-learning platform dedicated for medical students and doctors, where they can diagnose and treat patients in help with artificial intelligence algorithms, and so they can achieve theoretical knowledge and practical skills without leaving home. We're also providing a safety environment for students where they can make mistakes and learn by mistakes. They can avoid these errors in a real patient, in a real practice. And we're giving to our users an infinite number of cases in a different fields of medicine, EBM and AI-driven solution. In MedCases, the user can interview the patient, physically examine him, order some additional tests, diagnose, and propose a treatment plan adequate to the current clinical situation, and get a deep data analysis of his profile. So how did they go with the patient? And we have about 16% right now on board, 10 medical doctors and 6 IT staff. And our business model and market is basically we were addressing this app to medical students and doctors. It was B2C, but now we are making another version, another solution. It's Medical University for medical universities, MedCases University. And this is the B2B and licenses and plans. And next to, we are trying to provide solutions for nurses and paramedics also. And we are marked on Polish market right now. We have about 10,000 users using this app, and we get some analytics from this year. And students became more confident in contact with patients, achieved great knowledge about diseases, symptoms, abnormalities in additional tests, make correct diagnosis faster and more frequent, and know the schemes of treatment, and they can use them in practice. And from our analysis, the number of correct diagnoses increases about 9% after a month of using our app. Accuracy of medical interview about 6%, and accuracy of physical examination about 15%, and correctness of diagnosis test performed about 13%. We have already done 200 diseases ready to simulate by our generative adversarial network. We have, as I said before, 10,000 users right now on the Polish market, and from July we are starting to expand the market to the other countries. About 4,000 verified cases by our doctors and manually created also, and 60,000 solved medical cases by our users. We also have a great user feedback, and
so Mariusz,
that's all great. Yeah,
great.
because
So
I see it's
yeah,
times
we'll go
off.
on to Q&A.
Yeah.
Questions, Wojciech, Mikołaj, Christian?
Can I have a first question? So, Mariusz, thanks for the presentation. So, actually, what kind of problem you're trying to solve? Are you trying to replace the, let's say, ineffective medical education, or you're trying to supplement, let's say, the actual, let's say, medical curricula with something? I mean, what is here the major problem that you're trying to address with your solution?
We are trying to supplement the students and doctors. While studying medicine, I realized that we don't have any solutions where we can practice medicine after the hospital classes. And that's why we're looking for some solution to help other students like me supply practice, not only theoretical knowledge, but also practical.
And can you give us a few words about the competition? I know it's a quite crowded market when it comes to medical education platforms.
There is one similar but not the same solution from Hungary right now. And they started their production version in 2018, I suppose. We in 2019. We had a version from 2013, but this was just first prototype, not the production one.
And then pricing?
In Polish market, this is lower price, but in for example, the USA and UK, we have about $25 per month and 240 per year.
Okay.
Okay.
Any more questions?
Mariusz, one more thing. So you said you're moving to B2B model. So how you want to, let's say, tackle, let's say, the way the universities are budgeted, at least in Poland, this is, a top-down ministry, let's say, dotation coming from didactics every year. And somehow, let's say, the budget lines are quite strict. Universities also have their own e-learning platforms, and medicine requires this face-to-face interaction with the patient. So how do you want to make your value proposition for the universities? And I know your competitors have the same issues.
Yes. For nowadays, this is a strange situation, epidemiological, where the students cannot go to the hospital and learn and practice on real patient, talk to the real patient. So we are giving the opportunity for that. And we are making MedCases University solution. This is very AI-driven solution to help develop students, to help improve students gain their best knowledge that they could from virtual patient. And we do not have any university right now, but we are looking for partners and make solutions together.
Okay, great. So that's the bell ringing, at least in my ear. Mariusz, thank you very much. But before you go off, let me just say one more thing. We finished this batch of presentations or pitches. 2 points. One, I want to say again, thanks to Mikołaj with the EIT Health InnoStars, which is offering 2,000 euros of value to the winner of the MedTech pitch today. One more thing, we've got a new poll in the poll section, which reads, would you attend our YuMuuv Summit in-person event in October in Warsaw? So do give us a yes or no to that one. And thanks again very much to all of you guys, Wojtek, Christian, Mikołaj, for being on the jury. Don't forget to submit your forms to rank these guys here. And I hope to be in touch with you separately at some short time in the future.
Thank you very much.
We're back on at 15 minutes, so actually 10 minutes. So
Thank you. Bye-bye.
Bye-bye.
Yep. Great. Thanks, Wojtek.